And as I say, colorectal cancer is extremely preventable, and this is why I'm going to tell you. Now, this slide essentially shows how the cancer develops. It starts from a polyp, which is where I'm circling down on the left-hand side. This was in a fairly young lady, 35 years old. Now, a polyp at this stage, at this size, is non-cancerous, but it's got the chance to develop into cancer in the next 8 to 15 years, sometimes shorter, 8 to 10 years. And the picture on the right shows a cancer. So as you can see, this is like for us who do gardening. If you find a weed, which is the polyp, and there's a very young stage, if you pull out the weed, then you won't have an issue whereby a few months later, your whole garden is infested with a weed. And that's essentially the idea for colorectal cancer and how it's so preventable. You find a polyp, you take it out, that particular polyp will no longer develop. And of course, then the next question is, what's the best way to check for colorectal cancer? And in my opinion, and it's something that I myself believe in, and for that matter, I've already done 2 colonoscopies from my age 37 till now. And I'll say colonoscopy is the best method to screen. And when we use the word screen, we mean that the patient or the person undergoing the scope has no symptoms. And when you do that, you achieve 2 important functions. Number 1, you achieve what we call a prevention function. Why? When you do a scope, as I mentioned earlier, you pick up polyps. Can be small, can be large. You can remove them during the scope. By removing, the polyp will no longer develop into cancer in the next 8 to 15 years. And if you see that you then screen a little bit more closely, maybe sometime about 3 to 4 years, then what happens is every time there's a polyp, either the polyp had grown in the 3 to 4 years, or the polyp was missed from the previous scope, 3 years later, you do a scope, you pick it up, you cut it away, then that polyp also has no chance to develop into cancer. So if you do that very regularly, as you can see, you almost have no chance of developing cancer because every time it comes up, you take it off. So that's how colonoscopy is very preventive in nature. Now, the next question is, okay, if you're unlucky enough and then it turns out that by the time you went to do a scope, you're already 52 years old and then they find something, then I think in a way, the advantage is that you've discovered it early when you have no symptoms. And as we are all aware, as long there is no symptoms, the cancer tends to be at the earlier stage. And therefore, if it's earlier stage cancer, then eventually if you go on to have surgery to have it removed, your so-called outcomes tend to be better.
Terima kasih telah menyaksikan video ini. Dan jangan lewatkan video menarik lainnya dari channel Tekon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tekon TV.